now. So what have to do? So this is the main problem. So for the younger individuals, and also because of some misconception, they will develop sexual problem. The first is, as I told, nowadays people are getting married after 30 years. So that is also one factor. So up to 30 years they will compare. During my college days it was good. Nowadays I am not having. At the 32 years, how I can manage, how I can get married. So this makes them in peril. Late marriages, that is first sexual failure, as I told already, that makes them anxiety, fear, guilty complex, fear of pregnancy, STI, fear of STI. So first failure may be due to so many things. In a new place, uncongenial place, some sort of fear, whether it can do, whether it will be caught. So many things are there. Because of that, there is every chance for failure. So this failure have a deep impact, and it will reflect on after his marriage. Faulty position, so that's also there. I will come later. And it all end in poor self-esteem, and sometimes the patient have, I am not good, I am ugly, I am not good looking, I am black, I am having some other problem in the face. So it will be, so he will have poor esteem and poor secondary sexual characters. That is we have to establish. So this patient who is not having our proper secondary sexual characters, that is a different entity. They may have difficulty even in the younger days. Obesity and size of the penis, genital dermatology conditions all can end in ED. Once again, poor self-esteem, lack of confidence due to misconception, faulty position, and one failure ends in pressure from hormones. Vaginismus of the partner, more being blamed, male being blamed. So most often the patient, the spouse, this is married. So this is in the case of married. So the individual faulty position. What is faulty position? Most of the sometimes girls don't know how to be in the sexual position, that is more or less lithotomy position. When they are having legs stretched, nobody can penetrate. He will try, and it may end in some pain in the partner. So that pain may lead to vaginismus. And this person, because of that position, he may not be able to introduce, and he will ejaculate or sometimes have lost erection. So what will have impact? So because of my masturbation in younger days, it happens. I am having some problem. I am having impotency. So like that he will develop, and he cannot act further. So that is the thing. And vaginismus, it may be due to so many causes, has been dealt elaborately yesterday. And vaginismus, I want to tell one thing, one sign, good sign. Whenever the man approaches her, she will receding back in the position. So when you get the history, that could be a case of vaginismus. So I had. So that vaginismus, first coital position, when he introduced somewhere else other than vagina, it may end in pain, and she may have vaginismus in future. Elders complicate the situation. So what happens in vaginismus? The patient does not know, the spouse also does not know he is having vaginismus, she is having problem, and the man was blamed often, he is not doing that. So what will happen? It will have impact in future, he will have total loss of erection. Now, semen is precious. So it's a myth prevailing in the community, and especially among that is spread by the alternative medicine people. I used to tell, see a young individual who married on 25 years, and at that time, what will the frequency of sex? At least daily 3 times. If it happens for at least 6 months or 1 year, you just calculate for 3 months, and daily 3 times. And after 3 months, how many times he would have time, and how many semen he would have wasted, and how much blood, that is 1 drop of blood is equal to 60 drops of, that is 1 drop of semen is equal to 60 drop of blood, 80 drops of blood, all these misconceptions are there. So you calculate that. See, if it is so, he would have lost at least 40 lakhs of drops of blood. How is the groom after 3 months? He will be super, that is he will be put on weight and with a smiling face, and he will be polished very much. So what happens? So the semen is not how it lasts. I used to tell something. I got married for 46 years. I had masturbation before that 7 years. So for 54 years I'm wasting my semen. How I am looking? Am I walking with a stick or something like that? No, no, no. So this is thing. How semen is precious. So you have to tell how the patient understood. So that is very important. Convince him. Then he will gain confidence. So following that, so some people will tell, I am having weakness following ejaculation. I am having weakness following the intercourse. So it is not weakness. It is a tiredness. So it is misinterpreted. So following any exercise for running or climbing a hill or a strenuous work, anybody will have tiredness. That it is a tiredness, it is not a weakness. We have to convince them. So all these things will make them confidence, and they will be gaining their and confidence, and they will perform well. Dart syndrome. So it is not unusual to have early morning discharge, some other prostatic discharge, or nocturnal discharge, or sometimes when the people, when it is called Bangladeshi syndrome. What is Bangladeshi syndrome? Usually the Muslim people from Bangladesh usually gone for abroad for working purpose, usually alone, not able to take, but because of their going for small labors, they will not take their spouses with them. So what happens? They will have sexual abstinence for years together. So they will have some sort of prostatic discharge or nocturnal emission, and following that they will imagine the semen is precious. I told you already, semen is precious. I am losing all my blood, all my energy. It should not be wasted. So I am having back pain. I am not able to. I am having weakness. This back pain may be due to his job, occupation, but you will not understand. So all these things put together. So that is called as Dart syndrome. We have to convince. See, it is not weakness. It is only tiredness. Each and everything we have to convince. Coital failure and consummation. I told already. That is leg stretched. Nobody can introduce. So that is I told already. And masturbation. When we are hungry, we are eating. When we are thirsty, we are drinking. When we are having nature's call, we are going to. Similarly, from 17 years onwards, everybody will have some sort of sexual drive. But getting married at the age of 30, they cannot touch a girl, neighbor girl, opposite girl, roadside girl, and if you go to sex worker, you will get STD or HIV. What to do? Everybody will masturbate. So nearly 80 to 90% of the people will masturbate in the men, and 30 to 40 females are masturbating. No difference in ejaculation either with sex or masturbation. I used to tell, what is this? This is coitus. What is this? This is masturbation. Do you have separate semen for this, for this? No, sir. Then how it can be injurious masturbation? So this is simple thing. You have to explain them in their words. Then they will gain confidence. And this will not, when the man is getting married at the age of 21, and he is getting even prior second marriage, third marriage, and having 15 children, they are not having any nervous weakness. Why can't you? Why are you? So like that you have to put in simple words. They will understand. And nocturnal emission. So this is also very simple. You are talking with me. Your brain is working. Your eyes are working. Your nose is working. Your heart is working. Your kidney is working. Like that your reproductive function is also working. Not at the time of only you are doing sex. And semen is produced continuously and stored in your body. That is a place for storing epidermis and seminal vesicle. When the store is full, when you are not using it, when you are not disposing it, it is like a tank overflowing, like a bucket overflowing. So this is the thing. Why you are worrying? So this is not going to harm you. And especially this nocturnal emission is more common with who people engage in masturbation, frequent masturbation, and suddenly stopped because of this masturbation is injurious. Then they will have this sort of nocturnal emission. So everything has to be explained in the way that how can they understand. So then frequency of emission, that differs from age to age. So depends upon the age and also depends upon the duration of the marriage. So it is when the duration of marriage 10 years, 20 years, 30 years, frequency will come down. When the patient 25 years, the frequency will be different. When the patient is 40 years, difference, the frequency will be different. And the sexual weakness, I told already, it is not weakness, it is a tiredness. And size of the organ, it is decided by the genes, genetics in our from our ancestors, not able to be changed with the medicines. Like I used to tell, can you change your nose? It is a small nose, you want a big nose. Or if it is a big nose, you want to reduce it. Like you cannot change your size of the finger, size of the ear. Then it is how it is possible. So all the advertisement fake. Only thing prosthesis is possible. That is good. Otherwise, that is not, you should not be cheated. And sometimes, and they will tell mine is going smaller because of the belly, obesity, pubic mass, it is sunken, and sometimes pubic hair. They may not be able to see. So we have to demonstrate in the erect position, pushing the abdomen. So it is possible. And prosemen. So after seeing the pre-ejaculatory fluid, during erection, 1 or 2 drops of clear fluid will come. So some patients notice first time and thinking my semen is coming out, premature ejaculation. What should I do? I cannot. So they will lose the erection. And loss of erection, any interference in the sex, any thoughts. Am I all right? Am I normal? Can I do? Should I meet a doctor? So all these things will cut off the erection. And sexual weakness, that is a middle-aged problem. Middle-aged problem because mostly it is because monotony. So the patient should be aroused when he touches his wife. It is good when he is younger, when he is newly married. When the years are going, he is accustomed to his wife's body. Monotony, same position, same room, same position, same technique. So I have to tell him, change the room, change the dress, nightie, sari, sari, nightie, or without dress, or doing not the same position, hugging in the standing position, sitting position. So there are so many options, putting the light or in the daytime. So many ways. And becoming shorter days, so that is why I told, because of the obesity. NRI syndrome, this is another thing, non-resident Indian. So they will come once in 6 months, once in 2 years. So they want to have sex compensate this gap and come and do 3 times, 4 times want to do. One time, first day, good. Second day, better. Third day, fourth day, not able to do. Then next time, last time I had, whether I can do it now? No. They will end in peril. So according to the age, according to the time duration of marriage and your things, all these things you have to adjust. Not want to, you cannot eat for 7 days. You cannot eat the last 7 days. So this is the same thing. Fertility period. So most of the gynecologists, whether they are not, I don't know, gynecologists, they will put from the 12th day to 20th day, you have to do like that. So he may be at the age of 40 or 45. So he may not be able to do. First day he will do, second day he will do, third day, fourth day, now. Then next cycle, from the first day onwards, they will not be able to do. So the wife will tell, oh, we are not having children, we are taking treatment, why you are not coming? Then he will see his wife as headmistress, not as a mistress. And flow seminis. So there is no way, like a mouth, like nose, it cannot go, enter everything. It's only, cervix will open only during the time of birth and also abortion. Otherwise, it will be closed. Only few drops will be entering into the that is capillary action. So rest will come out. So we have to explain. My semen is become watery. How many semen you have seen? Have you seen hundreds? What are you going? If it is a unmarried man, don't worry. We will see after 6 months after marriage. Then we will worry. We will do. And married man having 2 children, my semen is watery. What are you going to do? Are you putting omelette? Going to put omelette? Premature ejaculation. I used to do. I encourage premature ejaculation. You are having more power. You are having more liking. You are having more vigorous. That is making them confident. And I used to put masturbate at the time of if it is they are young, masturbate after lunch and have the thing at the 10 o'clock. You will do better. Or sometimes you have the night premature ejaculation, early morning 5 o'clock. Do it. So otherwise, Gegel's exercise. All these things are there. And drugs lastly. Cardi, deviation. So our Pratap, that is that Kothari used to tell, the thief comes not necessary to enter in the straight. If he sleeps like that, everything he is entering. So what do you worry? As long as you are enter. And ED old age. So reasons, everybody knows. Monotony, comorbidity, hormone decline, and less stimulation. So all these things. Other causes of ED, organic and congenital, hormonal, neurological, obesity. So this is everybody told. So now approach. Control the comorbidities, find the offending drugs, partners, cooperation, hormonal substitution, and that is a benign process enlargement treatment also may result in that is ED, and control the frequency. So everybody wants even the age of 60, I want to do 3 times a week. It may not be possible. So spacing, sex in situation, pregnancy. So people ask, pregnancy, the first trimester, if there is a history of abortion, not to do. If the last trimester, if there is the history of preterm, not to do. Otherwise, there is nothing. Even the villages, previous to the delivery, they are having the sex. Don't worry. And similarly, circumcision, abdominal surgery, till complete healing occurs, rest. Cardiac, if you are able to climb for 30 steps without any trouble, go ahead. And if you are having menopause, yesterday discussed, after hysterectomy discussed, masturbation is nothing. And drug treatment, 2 slides. Menstruation is nothing, it's a normal physiological, like a sweating, like a saliva, like a thing, nothing to worry. Only thing, it will be discomfort to the partner. If she is not feeling that, don't worry. Drug treatment, I usually put low Tarlafil. Abstinence, there should not be a pressure of performance. Abstinence relieves the pressure of performance and put him on Tarlafil. Stimulation, abstinence, and sensate focus. All put together make him confident. Then slowly counsel and allow him for sex. Carry home message, don't look forward the treatment immediately. Understand the problem, interact, clear the misconception, doubts, problems in simple words, examples to their apprehension level. Then decide about the drug treatment. And abstinence always plays a major role during the treatment and recovers their drive, confidence, alleviates their pressure of performance. Thank you very much. Sorry if I exit.
Any questions from the audience? Please, we'll have a discussion for 5 to 10 minutes.
Dr. Buj from Gujarat. You just told that first step of the treatment, low dose of tadalafil and counseling and abstinence and everything. That is great. But we are here to know the next steps. Then what?
Correct, very good. So if the patient, sometimes he may have hormonal deficiency. You have to see the hormonal pattern and accordingly. Then if the patient is mentally retarded, if his apprehension is not correct, and if he is having secondary sexual characters, no, like that. And if everything goes well, and if he is not that, we can go for demand sildenafil citrate, 50 milligram before the act. So that will do good along with the nutraceuticals and other things.
Sir, I am Dr. Bharat Sarode from Pune. Actually, many times these hypoactive sexual disorders are there. But a couple of patients who are having a hypersexuality. I am having currently one 63-year-old retired person. He demands 3 times daily sex for his wife, and they come for counseling with me. So what to do about the hypersexuality? There are few patients, but they are there.
3 times a day is not a hypersexuality. Masturbation.
At the age of, 6. At the age of 63.
At the age of 63, I have to compliment him. I have to envy him.
What about wife? Right. Wife came. He was not having the problem. Wife is having the problem.
Sir, rule out bipolar disorder in panic.
Yeah. That is there. Yes. I have given mood stabilizer and that I did all those things, but
I used
this is
to
not
give
now. This is not now. So this was for pretty long time since he has having affairs with his maids also, and then now wife came to know he has had affair for means 25 years with her maid. He convinced his maid, and he had a regular daily sex with her.
As long as it is not injure his health, as long as it is not disturb with their life, continue. And also, you can have masturbation. If the wife is not cooperating, have masturbation. Nothing to worry. So it is a individual built. As long as it is not going to impair their day-to-day rate, nothing to worry. And you can give some sedation, that is antidepressive drug, it will definitely reduce their drive.
Doctor साहब, पुणे डॉक्टर, this is a personal question. वो कौन सा चक्की का आटा खाता है?
Sir, a comment on you. Can I comment one thing? Sir, psychiatric causes needs to be ruled out in this case. Sir, what causes? There are numerous causes. Okay, sorry.
Hello.
One
Actually,
of the most
this is-
important
this
causes,
is
as
not-
the sir pointed out.
I am
could-
having
could be a-
for last 30 years nearly 5 to 6 patients like this. So I do psychiatric practice for last 30 years,
Okay.
having more than 30,000 patients. So I ruled out all these things, and I have treated them very well. One patient was proxy treatment. I have given antipsychotic, and that problem was solved. Another person also having a proxy treatment. He was having, actually it's unimaginary. Every 2 hours he had sex with his wife, and his wife was quite frustrated. One general practitioner called me, she is quite frustrated, and what we can do. So every 2 hours he was demanding, and she was quite frustrated. And
One of the
right.
sir.
So
One of the most common cause that they don't really tell is infidelity. Do you know that?
infidelity.
Yeah.
Yeah, it was there. Na. Even though
What exactly happens? What the cognition behind this is that when the patient has this delusion of infidelity with the wife, that the wife is having an affair.
No.
Then there is a
that was not there. Even
tendency
he
to-
was telling ki you can do the things. She was quite loyal, and he knows. I asked him, I asked his wife, tell him what you are doing. Can I do with another person?
person is not doing, if he is doing continuously since his adulthood and now he's continuing 63 years, then it is normal. But suddenly he has started increasing,
No.
then it's
It was not
normal,
a sudden
sir.
problem.
There is
Wife,
some psychiatric problem in this.
wife knew after her retirement, she had that, and then he revealed everything. I had such type of relationships, and now this is the problem, and this is normal because you was not satisfying me. So it is normal in the Western world having a multiple affairs, so I can do. Then she told, can I do this? So sir, you are free to do all these things because these are my needs, and I can't do. He had having a cardiac problem. Wife also threatened her, you will die. So I will die with this, but I want this.
Thank you,
So he
sir.
was so much reluctant.
Sir, we'll have discussion later. One last question too.
Yeah, sir.
Sir, Murugan, sir.
If we suspect ED, then tadalafil should be given, as you said, in the lower dose. So it should be 2.5 or 5 milligram.
5 milligram. I used to give 5 milligram daily. Daily for 1 month, he will definitely have some improvement along with abstinence. Definitely. If his secondary sexual character hormones are normal and without any pressure of performance, he will improve. He will show improvement.
Like twice or thrice a day. emission occurs. And what
Even
to do
that,
then?
he need not worry. It will settle automatically within few weeks. Nothing to worry. It
They
will not
complain
impair
ki-
anyway. It will not impair. Because of his hormones and other system, it is not going to affect anyway.
They complain
Convince,
underwear
counsel,
get-
convince, assure. Nothing to worry.
Sir, how do you deal with the erectile dysfunction due to arterial causes and the erection is not?
So, organic, I am not doing much. I am not covering. So usually, I will, if I find anything, I will refer to some other vascular surgeon or something like that. And usually, even on that people also some amount of psychosexual part will be there. Sometimes they may improve. And otherwise, if there is a marked problem, I will refer to somebody else.
Murugan sir, nice presentation. I have one comment. You said the watery semen, my semen become watery, and you have given the analogy of you तुमको क्या omelette बनाना है क्या? तो the logic behind that the patient tell कि the watery fluid slips easily. So premature ejaculation problems come by thin liquid fluid, and if semen is thick, then it will long last. So how you will counsel that type of person in
What,
your
sir? What, sir? If the frequency is high, that
no.
dilution will go.
Their logic behind the liquid, if it is a watery, then premature ejaculation is going to happen, and if it
No.
their logic.
We have to assure, we have to convince. But it's a watery, that is diluted semen will have problem only for fertility. If the patient is having fertility, you have to give more attention to that. Otherwise, it is not related to sexual function. Sexual function is different and spermatogenesis is different. Don't combine. And actually, in younger individuals, before marriage, I will not advise, even for sexual problem, I will never advise seminal analysis. Because if you comment something, the motility is little low, you have to treat it that like that. If you have varicocele, if you treat like that, that will have impact, they will have sexual dysfunction. So, seminal analysis is not necessary. If he is having that is not able to produce young ones after 6 months of marriage or 1 year of marriage, then you have to worry about the dilution or semen count or anything. Till then, don't give importance to semen thing.
Thank you very much, sir.
Thank you.
I now invite Dr. Ajit Pradhan sir to felicitate Dr. Murugan sir.
Side. Thank you.